So now we're going to move to House File 620, Representative Demuth. And Representative Demuth, a member of our committee, is going to move that House File 620 be laid over for possible inclusion in the finance bill. And Representative Demuth, you have an A1 author's amendment. Is that your amendment?
Thank you, Madam Chair. Yes, I do.
And did you want that now, or do you want to wait or explain it first, or have us adopt it, or what's your pleasure?
Yeah, if we could move that now,
Okay.
And I can give you a brief overview if you'd like.
All right, well, let's adopt the amendment and then you can explain the bill as amended. So Representative Demuth is moving the A1 author's amendment. Please unmute yourselves, members. All in favor of that amendment, please say aye.
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 Any opposed? The motion prevails. The amendment is adopted. All right, please explain your bill as amended.
And thank you, Madam Chair and committee members for hearing this bill. I want to say thank you to the co-chairs. The co-authors. We have bipartisan support, Representatives Tice, Heinrich, Freiberg, Feist, and Ryer. So thank you to my co-authors on this. I'll just briefly touch on the A1 amendment and then I'll go over the bill. The A1 amendment makes two small changes. It first expands the dental residency grants to include advanced education in general dentistry residencies. These residencies are typically based out of community health centers or nonprofit group dental practices. Both these general practice residencies expose dentists to diverse patients, a high percentage of public program enrollees, and treatment for children, adults, and elders with complex medical, behavioral, and dental needs. The second portion of that amendment changes the appropriation for the rural dentistry scholars expansion to pass through MDH, and that was on the recommendation of fiscal staff. So that's what the amendment does. And then going into the actual bill, HF620, as we've already heard in this committee, we know that access to dental care in rural Minnesota remains one of the state's biggest health problems. A 2018 review by DHS found that 55% of Minnesota counties were designated as full county dental health professional shortage areas. Another 7% of counties were partial health professional shortage areas. Looking at the map of Minnesota that was provided you can see how severe the issues are, especially around the state in greater Minnesota. We know, as we've already heard, and again, that poor dental and oral health doesn't stay constrained in just our mouth. The science shows that poor dental health is linked to diabetes, heart disease, stroke, and more. Beyond these health impacts, poor oral health can also impact a person's self-esteem. Preventing poor oral health can sometimes be as simple as just ensuring that people see their dentist regularly. But if people don't have access to dental care, though, these steps become much more difficult. So HF620 aims to take on this problem by attracting more dentists to work in greater Minnesota in three ways. First, expanding the health professional loan forgiveness program to include dentists who agree to practice in rural areas. Second, creating a new dental residency grant program to support current and new dental residencies outside of the metro area. And the final way, by expanding University of Minnesota's Rural Dentistry Scholars Program. So by both creating new solutions and building on our existing ones, this bill will help attract new dentists to our rural areas. And by addressing this critical shortage of providers, we can protect the health and the residents of greater Minnesota and our state overall. And I do have a letter of support that was included in our packet from the Minnesota Dental Association, and I do have two testifiers, Madam Chair.
All right, thank you, Representative Demuth. Appreciate that. And so carrying on with our theme here, this is about, I think it was like the third leg of the stool, right? So getting more dentists, getting more providers where we need them. So the first on my list is Sarah Wovcha, I believe. I'm sorry if I'm saying your name wrong.
Yes,
welcome.
That's correct.
Welcome. Go ahead, please. Introduce yourself and give us your testimony.
Good afternoon, Chair Liebling and members of the Health, Finance, and Policy Committee. My name is Sarah Wovcha, and I am the Executive Director of Children's Dental Services, which provides a full range of community-based dental care across Minnesota, targeting low-income children and pregnant women, and also serving adults of all ages. I support House File 620. Children's Dental Services serves 37,000 low-income patients annually within 54 Minnesota counties, 42 of which are designated dental professional shortage areas. Children's Dental Services has been posted continuously for a dentist position in rural, northeast, central, and southwest Minnesota over the past 5 years. We've received an average of 2 applications per year and have not been able to fill these positions. As Representative Demuth provided, rural Minnesotans have fewer options for dental care and worse oral health outcomes than their urban counterparts. In Minnesota, the dentist population is 1 dentist per 2,272 small town or rural city residents. One dentist per 3,938 residents in rural isolated cities. So for example, we provide care all the way up to Ely and all the way down to Worthington, where there are 2 counties with no dentists at all. And as compared to 1 dentist per 1,601 in our urban regions. At the same time, the average debt of dental school graduates approaches a staggering $300,000. And without loan forgiveness, these dentists simply cannot afford to practice. We must support these dentists to ensure they can serve our most vulnerable Minnesotans and to encourage them to practice in our rural, underserved communities, reaching out to those who need it most. So thank you so much for your attention. And again, I urge you to support House File 620.
Thank you very much for your testimony. Welcome, Dr. Helgeson. Please go ahead.
Thank you so much, Madam Chair and members of the committee. I'm Dr. Michael Helgeson, the CEO at Appletree Dental. Today, I'm speaking on behalf of Dental Access Partners, which includes not only Appletree Dental, but Hennepin Healthcare and Community Dental Care. Together, our 3 critical access dental organizations serve patients of all ages from 85 of the 87 counties in Minnesota, and more than 80% of the patients we treat are enrolled in Minnesota public programs. So I want to be personal. At Appletree, we have 6 centers for dental health located in rural Minnesota and 2 in the Twin Cities. And I know firsthand how difficult it is to recruit dental professionals to our rural locations. And that's why supporting all 3 aspects of House File 620 is so important to me. First, the dental student loan forgiveness with that huge figure of student debt that you heard from Sarah. It's so important. The pressure to earn a high income in an urban setting is enormous. And so having that student loan repayment to get them to settle and practice in a rural area is really critical. Second, the School of Dentistry's Rural Scholars Program brings dental students out into rural communities while they're in dental school. And that is something that helps direct them to practice in a rural community after they graduate. So that's a really important program. And then finally, the dental residencies are really critical. Dental residencies provide that advanced training. And in a rural community, dentists don't have specialists by the scores to refer to. They have to be comfortable doing some pretty advanced things. And residencies are the things that prepare them to do that. And on the medical side, we know when medical residents rotate in rural communities, they tend to practice in rural communities. So all 3 of these aspects are really critical. And I want to thank Representative Demuth for accepting this friendly amendment to include the AEGD as well as the GPR residents. And in closing, expanding rural oral health workforce is just critical for Minnesota. And this hits on 3 key topics. So thank you very much.
Thank you very much for your testimony, Dr. Helgeson. And I know you've done a lot of great work around the state, very innovative ways to reach folks as well. So, I don't see any questions from members. I do have, oh, okay. Representative Munson, go ahead, please.
Sorry, Madam Chair. Yeah, my question, I guess for the bill's author would be, in line 2.11, 2.11 to 2.15, we're changing existing statute to say that this a dentist qualifies for this program if they take 25% of public program enrollees or MA patients, or they just agree to practice in the designated rural area. So does that language on 2.15 actually allow people to stop taking MA patients as long as they're practicing normal dentistry in rural areas, that they would continue to be available for this program?
Representative Demuth?
Thank you, Madam Chair, and thank you, Representative Munson, for the question. As it does read, or that is my understanding, and if I am wrong, I would go to House Fiscal Staff if there's a correction to be made with that.
Representative Munson?
Yeah, I guess the way that I guess I would defer to House research to see if they could answer that question, because as I read it, it sounds like it's taking the bill in the wrong direction.
Ms. Clark-Fist.
Madam Chair and Representative Munson, this just makes the dentists eligible for loan forgiveness. So they're eligible for loan forgiveness if they either agree to practice in a rural area or agree to serve that number of public program enrollees.
Okay.
Representative Munson?
Thank you, Madam Chair. Yeah, so as it is now, they're available for loan forgiveness if 25% of their patients are medical assistants or state public program enrollees. But it looks like we're no longer making that a requirement for loan forgiveness, and that we're just saying that they have to practice in rural Minnesota, which, I mean, we have, not that we have plenty of dentists in our area in rural Minnesota, but the really hard part is finding people that take MA. And I think that this language would allow more dentists to stop taking MA and still get loan forgiveness. So I caught that and I had to ask a question, but it's an area of concern for low-income people in my area. So,
okay. Representative Demuth, did you want to respond to that at all? You don't have to. I can go on to Representative Ackland, but give you the opportunity.
I would like to. So the intent with adding the access in rural, we're going to leave that public program, is my understanding. We'll leave that public program as it is, but it's something to take into consideration. So I appreciate the clarification asked for as we continue to move through.
All right, thank you. Representative Ackland.
Thank you, Madam Chair. A question for Representative Demuth. So the loan forgiveness is granted if a dentist practices in a rural area. And I've seen this similar program with medical students. But on those loan forgiveness, they agree to practice for a certain number of years. And I'm wondering, because I don't think that this has been mentioned, but I'm wondering, saying they need to practice in a rural area, is there a minimum length of time that they would need to practice? Is that included in your bill in that rural area? So what I'm saying is they could get the loan forgiveness, practice 3 years, and then move on. Is that a possibility here, or do you have some more parameters around their practice?
Representative Demuth.
Thank you. I'm just grabbing my papers here. They would get the loan forgiveness while they are practicing in the rural area, but if they would leave, then it would end.
And maybe we could get clarification on that too from Ms. Clark-Fist if she can just, and just members realize too, this is a great discussion, and I think it can be uncomfortable for an author to have members kind of say, here's what about this and what about, but we are laying the bill over. So if we have money to be able to do some of this, there's opportunity to amend it as well. So I'm sure Representative Demuth is taking notes. Ms. Clark-Fist.
Madam Chair and Representative Ackland, I think it's a 3-year service obligation, and that's in another subdivision in this loan forgiveness program.
Okay, great, great clarification. Representative Ackland, anything further? All right, thank you. And I do have a question for Representative Demuth, and that is, Representative Demuth, I think that the bill has a blank appropriation. And I realize that at this stage, you know, that's okay, but I just wondered, you know, this is the kind of bill that at some point somebody has to decide, you know, given if there's money available, somebody has to decide how much does it take? How much money will make a difference here? And I don't know if you are prepared to answer that or one of your testifiers, but you know, I could say perhaps, you know, facetiously, oh, well, here's $5. Is that going to be helpful? Well, no, obviously. So, you know, how much will it take to impact any of these things that you've got in the bill? That's something that as a fiscal chair, you know, having it laid over in our bill, it's going to be kind of a key question. So do you have any kind of response to that, or should I go to one of the testifiers?
I actually do, and thank you for the question, Madam Chair. As we've heard throughout this committee, we know that the need is great. And so we would like to put as much money forward as we could, but I think what we'll do is as we move forward, we'll, as you get your targets too, but we'll work with the dental associations and the other stakeholders to determine what the actual need would be, how we could serve more and get the program started and moving forward in a way that will be helpful.
Okay, well, that would be great, Representative Demuth, if you could, when you come back to us and when your helpers come back to us with this, if you could try to quantify sort of what do we get for how much money, you know, so that we have a sense of how many scholarships, how many dental students can we get out into these areas and so on, just so we have some scalability or some sense of the scale of what different amounts of investment would buy for the state would be helpful. So other questions from members? All right. Any closing comments, Representative Demuth?
Yes, thank you, Madam Chair, for the opportunity to present the bill. And I want to thank the testifiers for what they've shared and the support and the member questions. I think this is the perfect example of how we can make things better as we move forward. So I appreciate the questions. Yes, I have taken notes and I'll continue to work on it.
All right. Well, thank you very much for bringing the bill. And this is, you know, this is a big puzzle, as we've said on some of the other bills that we've heard here today. It's multifaceted, and we're going to have to, you know, keep trying to approach it from a lot of different angles so that every Minnesotan has the dental care that they need and deserve. And that is so important, as we know, as we've heard from you and others, Representative Demuth. So with that, the bill, House File 620, is laid over for possible inclusion in the Health Finance Bill.